weapons of mass destruction. Janie's got his hands in reconstruction. I can tell by the yellow in your bloodshot eyes. Even all big farmers' lies now. Keeping it real about your health. Hi, I'm Dr. Mark Walcott, and I'm a chiropractor, and I live on Cape Cod in Hyannis, and I've been practicing for about 21 years with my lovely wife, Roberta. What we're going to do is, well, my mission statement for this show is to help bring a greater awareness of what it means to be truly healthy in order to achieve a truly wellness lifestyle, a wellness lifestyle. Now, what does wellness mean? That's a good question. What does health mean? Does health mean, well, let me see, I'm alive, I'm upright, I've got a pulse, hey, I'm well. Well, that's not necessarily what health is. As a matter of fact, the World Health Organization has a definition of what health is. Health is actually a condition in which all functions of the mind and body are normally active. And it defines it as a state of complete physical, mental, and or social well-being, and not just the absence of disease or infirmity. So what does that really mean? Well, there are really actually 6 facets to health. And we talk to our patients all the time about this. It has to do with changes in lifestyle. It has to do how you take care of your body, whether you exercise, what kind of diet you have. So let's take a look at some of these ideas. There are actually 6 facets of health. One is proper exercise. Now, proper exercise of correct type and timing is very important. People say, well, the New Year's resolution is I'm going to exercise and I'm going to start it on January 1st and I'm going to be great, I'm going to get healthy. And then, unfortunately, those resolutions seem to pass by the wayside. So the main thing is that, let me show you a few things. I'm going to stand up here for a minute. And I'm going to show you that exercise is actually quite different than you think. There are a number of things you can do for exercise. One of the simplest things is just basic flexibility exercises. For example, being able to touch the toes and come back up. Something as simple as that, we call that a type of exercise of stretching, which is very important for facilitating proper use of muscles and ligaments. Flexibility is very important, but it's not the whole story. There's also aerobic exercise. Now, I'm not saying everybody has to be a jogger. We weren't all born to be like Johnny Kelly, who was a fantastic athlete even to his 80s. But I'm talking about something that raises the heart rate up to a certain rate for a certain period of time. Now, that could be brisk walking, which I do and I love to do. Swimming is perfectly great, too. In fact, it's better in some ways because you're exercising the body in a zero-gravity environment, which is easier on the joints, quite honestly. Bicycling is terrific as well. So anything that gets a heart rate going for a certain period of time. Usually we recommend anywhere from 3-4 days a week, 30 minutes at a time. Something like that would constitute a great program of aerobic exercise. And a third type of exercise that's important is weight training. And we all don't have to look like Arnold Schwarzenegger. Anyway, so aerobics are important. Weight training is important because it helps strengthen bone density, which is especially important for people who have a risk of osteoporosis. Because studies have showed that regular weight training, even using light arm weights or leg weights, are very effective in helping to strengthen specific muscle groups as well as to promote strengthening and solidifying of bone. So that's one aspect of health. Another is good posture. Now, what is good posture? I'm going to stand up again for just a moment here. You can check yourself in the mirror. We use 3 points. We use top of the ears, top of the shoulders, and the top of the hips. So if you look at yourself in a full-length mirror, if you're kind of going like this and one shoulder's high, then that isn't quite what it should be. Ideally, visualize there's a string attached to the top of your head drawing you upward like this. Your chin should be in slightly. The shoulder should be level. Hips should be level. And if I turn into a side view, one thing we see a lot in our office where people have what's called forward head posture. And that usually is a result of people driving a lot or, as a matter of fact, using a keyboard. And this is detrimental to the bones and the ligaments in the neck, because after a period of time, see, there's supposed to be in the spine a normal curve in the neck that bends forward like this, and a normal curve in the lower back. These are called the cervical and lumbar curves, or lordoses. And what can happen with forward head posture is the curve that should be there is straightened out, and now the problem is that the force of gravity is bearing down and it starts crushing these discs, and that eventually leads to a condition called osteoarthritis. That's not a good place to go. Understand that in addition to exercise and good posture is nutrition. And nutrition is important because we are what we eat. Simple as that. Now, I used to counsel people in nutrition, and I have a whole spiel about nutrition, what you should eat or not eat. You know, and I've seen all these different fads through the years, you know, everything from the Atkins diet to the South Beach to the Zone to this and that. And the main thing is, what I found is to just reduce your intake of carbohydrates of the simpler variety, especially the white sugar, white flour. Go for whole grains. Sugar is okay. In fact, I would prefer people to use sugar if they have to in place of artificial sweeteners, because there have been some studies that have showed there are some serious side effects from things like Splenda and aspartame. Saccharin turns out maybe the least harmful of all those three artificial sweeteners. We have a whole other show devoted to that, but we'll move on with that, as a matter of fact. So the main thing is, don't skip meals. Eat 3 meals a day. The largest meal should be in the morning, a moderate meal at lunch, and a smaller meal at night. Why? Because you don't want to go to bed with a full stomach, because your system slows down, then you can absorb more of the sugars and fats out of the food you eat, as opposed to eating a larger meal earlier. And I advocate eating lots of fresh fruits and vegetables. You want to alkalize your body, minimize as much as you can the starches, the heavy starches like potatoes, crackers, rice, cookies, you know, all that good stuff. But it doesn't mean you can't have some occasionally. Just don't feel like you have to deprive yourself. Now, sleep is important because our body heals while we rest. And, you know, I know, especially for you late nighters out there, I know who you are, you know who you are. Night shift at the hospital, people in the restaurant business or bars, you know, you come home, a lot on your mind, hard to unwind, you know. So a lot of us have reverse schedules where we work at night, sleep during the day, and that can affect these normal, what we call biorhythms that occur in our bodies. So the main thing I'll say about sleep, have a totally dark room, as dark as you can, because our body will synchronize to that. It has to do with the release of certain neurotransmitters in the brain. Talk about that later. Sleep is important because we recharge our body. There's this deep sleep phase when we first go to sleep, and we're not dreaming yet. That's a time when our bodies actually recharge and re-energize. And then the second stage is called REM sleep, which is rapid eye movement sleep. That's when we dream and we have an emotional release. That's very important too. So these phases of sleep are important. How do we get it? Make sure you have a very good current mattress. You have a pillow that's adequate. You know, in fact, if you have a regular mattress and you know it's time to replace it. If you took let's say a tennis ball and set it on the edge, it kind of rolls into the center where you tend to sleep, then it's time to replace the mattress. Positive mental attitude, very important, because nobody gets well unless they want to get better. And this has to do with everything from changes of your attitude, positive thoughts, affirmations, things like that. Meditation is fantastic. Anything to change the attitude, because if you have a down attitude, we know that emotions can affect our body and our health. And a balanced spine, this is why I'm really here to talk about, is the importance of having a balanced spine. So let's talk about the spine a little bit. You know, when we're very first time in the inception of life, okay, we go through stages of the zygote to the embryo and finally to the fetus. Did you know the very first organ system that's developed is the brain and spinal cord? Studies have shown that it actually, the combination, think of the spinal cord as like an extension of the brain. It brings a spark of light to every single cell in the body, and it runs everything, you know. So this is a chiropractic premise we will talk about. In fact, I'd like to refer to this chart over here. Our bodies are self-healing and self-regulating. Now, that's a powerful statement. It means that we don't have to think about digesting food. We don't have to think about breathing air unless we're on a respirator. If we cut ourselves, we don't have to think about healing that cut because our bodies take care of themselves. We have this thing called an immune system. The nervous system controls everything in the body, absolutely everything. Studies have showed this. When the nervous system is intact, then it will allow the immune system to do its job, which is to keep us healthy. When there is nerve interference can cause serious health problems. And basically, what a nerve interference is, it's a pinched nerve. You've probably heard that term before. And finally, chiropractic adjustments actually help to locate and remove nerve interference, leading to good health. Okay. So I'm going to refer back to this chart again. Excuse my low-tech graphics. It's what I have right now. Someday we will update to the digital world. The nervous system, the purpose of it is to control and coordinate all the different tissues, organs, and systems in the body. In fact, it's probably the most complicated and least known functional aspect of the human body. Did you know there are over 100 billion nerve cells, little tiny cells that make up the individual nerves that are permeated throughout our body? So very amazing control systems that are built into us. Now we're going to talk about something near and dear to my heart. It's called the subluxation. What the heck is a subluxation? Have you been to a chiropractor and he talked about, well, you have a subluxation at C5? Well, subluxation, there are a lot of theories about what the heck it is. You know, the simplest thing I can tell you is that it is a theory or a hypothesis about what we do as chiropractors, why we do it. We're trying to locate this thing called a subluxation. Sub means less than. A luxation is a dislocation. But also in Latin, the term lux means light. So in a sense, like beneath the, it's less than a subluxation, but it's also, we're beneath the light. And we'll get into that in a moment too. Now, what happens is when a vertebrae misaligns, and we'll talk about, there are 3 different ways it can do that. It will actually pinch one of these spinal nerves. Now, I have a little model here. I don't know if this will show up on the film out. There's a little green blinking light here. I don't know if we can zoom in on this thing. But when everything's lined up properly, the nerves work properly. If there is nerve interference, what will happen is the nerve will start getting irritated and inflamed. Now, it doesn't automatically cause pain. It takes a while for that to occur. But after a period of time, that nerve gets inflamed enough, several things will happen. The muscles around the area will get into spasm. If there happens to be one of these nerves goes to internal organ, like the liver or the stomach, you might start developing stomach problems. Now, as I said, this is a hypothesis. But, you know, in my experience in over 20 years of practice, I've seen this happen time and again. Well, people may experience like chest pain or pain in the heart. They think they're having a heart attack. They go to the hospital. They have EKGs. They have stress tests. Everything comes back negative, so what the heck is wrong? Well, the problem was that they come back to my office and I find out that they have a pinched nerve in their upper back around the 1st or 2nd thoracic area. We adjust it, and they're better. Now, it doesn't happen automatically because they didn't get like that very quickly in the first place. So now another concept is we're going to talk a little bit about the neurology of the nervous system at some point. As we were talking about before, we have the brain and we have the spinal cord. This is called the central nervous system because it runs along the center of the body. Now we have this whole intricate set of organs connected by means of what's called the sympathetic and parasympathetic nervous system, also bunched together called the autonomic nervous system. So the autonomic nervous system, the function of it is to regulate the internal organs of the body. For example, there are nerves that come out from the mid-back that affect the stomach that tell the stomach when it's time to turn on hydrochloric acid, or to make the lungs work, or to regulate heart rate properly. So, you know, there are actually 2 parts. The sympathetics will speed up the heart rate, but actually slow down digestion, because that has to do with a fight or flight mechanism. Also, the adrenal glands are kicked in when we get excited. So, but it's been found in studies that we can't be hyped up all the time. Well, we can, but the problem is it will wear the organs down, you know, so that's not necessarily a good thing. So just as sort of a little reminder, why the heck are we here? Because we're getting real about your health. Now, remember that we have the skull and the spinal column protect this area, okay? And there's one more nervous system that we have, and it's called the peripheral nervous system, all this in the yellow. Now, you know, just if you were to just go ahead and pull a little hair on your you know, a little bit of that fur on your wrist and pull it. And, you know, when it's telling you that you're pulling on it hard enough, that has to do with the sensory part of our nervous system. You know? Or if you ever been to the doctor and they tap your knee and your knee goes like that, that's called the knee jerk. See, what's happening is the impulse, you have a part of the nervous system that's receiving that stimulus from the outside, and then you have a muscle that's responding that causes your leg to go out like that. It's called the knee-jerk reflex. So these two systems are melded together in that sense. So you see, the body really is, everything is controlled by the nervous system. So what happens is that we have the idea of the subluxation. Once again, remember that pinched nerve effect? So the pinched nerve, many times when you finally do get pain, pain is sort of like the tip of the iceberg. And most people, you see this on TV all the time, probably every 30 seconds there's another drug commercial. Now, I'm not against drugs, believe me, but I say the appropriate use of medicine is right. But, okay, so you take an aspirin, ibuprofen, or whatever. So that takes care of the symptoms, but is it really addressing what could be the real cause of subluxation? Well, probably not. So what we do in chiropractic is we locate these subluxations, and using our hands, or sometimes some of us use a little adjusting instrument, we just make a very light little adjustment and take the pressure off the nerve and relocate that vertebrae. And the problem is that people think, well, the pain's gone, I must be feeling, doc, thanks a lot, see you later. And I have to say, oh no, they didn't get it. The problem is that ligaments and muscles have adapted to holding the vertebrae out of place. And so it takes a while to help, when you keep adjusting that vertebrae, to get back in place and allow the ligaments to heal to hold it back in place. Kind of like putting braces on teeth. Braces on teeth, the day they go on, they haven't corrected the crooked teeth, have they? I don't think so. So there actually are three ways that a subluxation occurs. The most common is like repetitive actions, or a slip and fall, car accident, repetitive. Does this look familiar? Just bending, twisting, raking those leaves, sweeping, whatever. That's the most common thing that people relate to. But it's really strange. People can be doing this, and then they sort of feel, okay, a little tight. They go to bed. They wake up in the morning, and they reach down to pick up a cup of coffee or something. Uh-oh, can't move, can't move. Now, the problem is they think, oh, it just happened. No, it didn't just happen. This problem was building up for a while. Okay, it wasn't an overnight thing. Well, sometimes you think it's overnight, but it's actually something was going on for a while, kind of like a decaying tooth in a way. Mental emotional is another way. If everyone really stressed, really bad day, and somebody's a pain in the neck, and that's where that term comes from. All of a sudden, all your stress goes to one particular area of your body, and the next thing you know, you have a subluxation. It's thought that a third type of way that vertebrae can misalign is through chemical toxicity. Very important, especially down on the Cape here. We're concerned about the quality of air and water, and just not that, the food choices, foods we eat, overdoing on any particular alcohol, medication, anything that can tox the body out. It all has to go to the liver, because the liver has to deal with all this in order to process and eliminate it out of our bodies. Okay, so these are the three ideas. Now, the hypothesis about the subluxation, is it a bone out of place? I don't know, maybe. Is it a nerve interference? Definitely. And joint dysfunction? Yeah, it can be that too. You wake up in the morning, your neck is stiff, you can't turn it as far. That's a joint dysfunction. So we talk about this in our spinal care class. There are actually three phases of care in chiropractic. And this could apply to any of the natural healing arts as far as I'm concerned. People come in and they have acute phase. They have a lot of pain. They want pain relief, so the aspirin didn't work anymore, so they come to us. So we do our best to get them out of pain, and so we get them out of the pain and say, hey, it's feeling better, doc. The problem is that they think they're better, but they're in what's called the correction stage. Correction means that we're trying to stabilize the ligaments and muscles, just like the idea of braces on teeth, so the vertebrae doesn't keep going out of place over and over again. And our ultimate goal, and that's what the show is about, is to achieve wellness, total wellness, which is to return to normal function. Now, for a lot of you, normal function may be, well, once again, I've got a pulse, I'm vertical, I got a few aches and pains, but I can deal with it, I'm fine, But there's a whole other level of health. There really is. It's called anti-aging, It has to do with wellness, returning to normal function, actually helping repair internal organ damage. Anti-aging, finally, we get organ and tissue regeneration, leading to better than ever street. Isn't that what really we want? It's better than ever street. So in fact, that's my goal for this series of shows. We will have guests. We'll have all kinds of fun. We'll have musical guests. The idea is, let's keep it up, keep it happy, And we're here because we're getting real about your health. Thank you very much. It's been a pleasure, and we'll see you soon. Well, I hope you enjoyed last week's show. Today we have a special guest. It's none other than my beloved wife and comrade and associate chiropractor. This is Dr. Roberta Walcott. We are partners in practice, and we've been practicing for about 30 years. Well, I should say 20 years, but we've been married almost 30 years. And tonight I'd like to have my wife describe what it's like being a chiropractor and healer from a woman's perspective. And so now tell me, why did you decide to become a chiropractor, Roberta?
Well, my goal in life had always been to help people. And becoming a chiropractor became a wonderful way, a great vehicle to be able to transfer that energy and to help people. It's very simple. You can help people by being supportive. You can help people by giving them advice, whether it's financial advice or nutritional advice, or you can help people by releasing the healing energy in them. And I have the wonderful good luck to be able to do that.
Excellent. So in a sense, you're working as a wellness coach or helping people guide them to a wellness lifestyle?
Yes, yes. I think ultimately it all boils down to the power that made the body heals the body. And as a chiropractor, I get to be a facilitator in releasing that energy in every individual. And so I do an assessment of where is a person on a health continuum.
Now, I noticed this chart behind us here, which you decided to bring with you. And could you describe a little bit about it? I notice on one end we have wellness, on the other end is illness. So why don't you tell us what this all means?
Now, let's see. I want to, can you still see that? I hope the audience can see this. The average person is somewhere on a continuum from having symptoms to just kind of having stability and being wellness. The average person is kind of in the comfort zone. They're just, maybe they don't have any symptoms. They just kind of eat in an average sort of way. Exercise is not real consistent. Health is not a high priority. The average person, as you said, you talked about health on your last show, and I did hear that. Their concept of health is, if it doesn't hurt, I must be healthy. There's more to life than that. So in the beginning, that's kind of a false wellness when we start out in the comfort zone. Let's say...
let me ask you something. So when comfort zone is, people are okay, they're not great, they have issues, but they're satisfactory survival.
Yes, satisfactory survival.
Nice.
Exactly. And that's what our society is that's acceptable in our society, to have satisfactory survival. Not good enough for me, I hope not good enough for you, because we want people to have optimal wellness. So as people get away from that comfort zone, they start to develop poor health. They get symptoms. They start taking various medications. And it might be a maintenance medication. They might be on something because of their high blood pressure. And then they might be taking something else for diabetes. And they start, they have a little surgical intervention because they decide that's the way to balance out their body again. They start losing their normal function. Then we continue, if we continue on that way from the comfort zone into the illness area, we start to have diseases. There's more multiple medications. The quality of life is poor. Your personal potential, this is what always gets me, the potential of an individual becomes limited. The body has limited function. You start your movements get smaller instead of having large movements and easily accomplishing the things that you want in a day. Your body kind of limits itself. Your shoulders become rounded. Your movements are smaller. And again, the quality of life is not as good.
A lot of patients I've seen the older patients in particular seem to have begin to get this prominent area back here. Is that what you're talking about, the process of degeneration?
That's a process of degeneration.
I see.
And when I look at my patients, when I'm first starting out, I have to determine where are they on their wellness potential. Are they in full-blown illness, which means there might be osteoarthritic changes that they can't do anything about, but we can still improve some of their function. I take x-ray so that I can see how much of these changes are there. What is the status of the skeletal system? Because we want to take that person from illness at least into the comfort zone, and then we're getting back into, this is the positive side of it, getting into wellness. I want to make sure I don't stand in front of here. So when we go, I start to work with somebody, and they start to improve. And maybe they had a neck that couldn't move, and it starts to move a little bit. And their eyes shine a little bit brighter, and they're able to deal with their mental, emotional, physical issues a little bit better. And they start, they like, okay, I want to do a little bit more than have adequate survival. Then we start into developing wellness. That's the really fun part. You start to have better health. You do regular exercise. Now, we both have quite a regimen. We have our hour of power in the morning. We get up and we do exercise. We do some Tai Chi. I personally have studied and taught Tai Chi Chuan for 35 years, since 1971, as you do also. We do a series of exercises every morning called psychocalisthenics, and it's a combination of breath and movement. We meditate every day. And I like to think we eat well. We have a proper nutrition, and that's a whole nother subject. I don't know how much.
We'll save that for another show.
We'll save that for another show.
I promise we will. We'll get to that.
You have minimal nerve interference. So as I do what I do, now I do chiropractic adjustments, and a lot of the audience might not know what a chiropractic adjustment is. Everybody has this concept. Some of the things that we do are very vigorous as chiropractors, and some of them are very subtle. And there's a number of different techniques that we use as chiropractors that are appropriate to each individual, whether it's a newborn or a 2-week-old or a teenager, somebody who works very hard laying cement, and somebody who works in an office at a computer, and the very elderly. There are a variety of chiropractic techniques, all appropriate to the individual. So I always want to assure the new patient that whatever I do will be appropriate and will help them on their road to wellness. So as we're developing wellness, we want it that the trip is towards optimal health. We want to be able to move as much as possible, to have as wide a range of motion as possible. We want to continually develop ourselves, not just on the physical level, the mental, emotional level. And I'll get to the next chart in a moment. You want to have active participation in all those around you. It makes you happier. And you want to have a wellness lifestyle so that it's not just a stop by the wayside, that we dedicate ourselves towards improving ourselves and affecting everybody around us in a positive way.
Just to interrupt you, have you ever had a patient said, oh, I used to be able to play tennis or I used to ski, and then you work with them for a while and lo and behold, they're starting to play tennis or ski again, or whatever they like to do.
Yes, they reclaim their life. That's the fun part of what I do, because then I get to see people make a positive change. And my original goal, remember you asked me at the beginning of the show, was to help people. It was very simple. Even when I was very young, that's what I wanted to do. I used chiropractic as the vehicle to do it. And I get the wonderful job of watching people change. People make positive changes in their life, and I love seeing it. So what are kind of some of the things that waylay an individual? There's the 3 T's. There's trauma, there's thoughts, and there's toxins. So physical stress are some of the things that push us from the comfort zone into the illness zone. They include the birth process. Having a baby is traumatic both to the mother and to the infant.
Why is that?
They have to come through the birth canal. You know, it's very tight.
Sounds like a tough trip.
It's a tough trip. It's a tough trip.
Imagine the baby's neck is getting twisted like this.
And then if they get pulled or tugged or
like in a cesarean birth, that's not necessarily a gentler form of birth.
No, it's not.
unfortunately.
The traumas of life. So we start out with birth, and hopefully we can, when I see a newborn or a very young child, we can balance out those things so they grow into strong individuals. Walking, sitting, standing. How many of you, you sit at a desk and you sit like this and you're sitting at a computer? And do you take the time to do the opposite exercises, to open up your chest, to shake out some of the tension in your hands and your arms? Sitting at a computer is very difficult. Having sports are wonderful. All of our kids they've sailed, they've done cross country, they've done a variety of sports. We adjust them regularly because there is trauma. When they played football, it was very traumatic, football. And anyhow, all the sports the kids do, and then the sports that adults do as weekend warriors. Yeah. On Monday morning, we tend to see a good number of those weekend warriors, whether they overdid it raking leaves or they overdid it on sports.
Yeah, I might add that professional athletes like Tom Brady, for example, he sees a chiropractor regularly. And it's not, well, yes, he gets injured on the field, but also, he said in his own words, because it helps him to perform better. It actually, when you increase the power to nerves, the nerves allow the muscles to work more efficiently. But sorry to interrupt you.
Yes, the power that made the body heals the body.
Exactly.
Okay. Regular activities, just the things that we do, whether we go shopping or, they can be stressful. You're carrying a lot of groceries, lifting your child, helping to move something if you stock shelves or whatever it is. Lack of regular activity is actually even worse than having regular activity. People get used to a sedentary lifestyle. And so that doesn't help either. Now, getting into thoughts. Thoughts affect us. A thought is, we all think of our thoughts as being in our heads, but they affect our body, whether they are financial, time, anger, stress, problems at school, relationships, family, grief. Let's say for a relationship or an individual, the stress at the job. It affects our body on a physical level. And then we have the other things that affect us, the toxins, poorly preserved foods, prepared foods, chemicals, overuse of drugs, whether they're prescription, tobacco, alcohol, caffeine. So those are all the negatives, the T's, that can take you from your comfort zone into the illness. Again, we want to return you to wellness. And it's over a period of time that the body heals itself. Again, as chiropractors, we release the power within. The power that made the body heals the body, and we get the wonderful job of allowing that to work as it's meant to work.
Well said, well said. As a matter of fact, last week, as you probably recall, I showed you this little demonstration model of what we call a subluxation. When the vertebrae is lined up properly, the nerve works properly. If you have a vertebrae that's misaligned, it causes a pinched nerve. That's a subluxation. And remember the three causes of subluxation: physical trauma, mental emotional trauma, and toxins in the body. So what we do is we find and locate subluxation. So tell me, Roberta, should I say Dr. Roberta,
yes,
how do you locate subluxations?
Well, when we're at school, we've developed incredible sensitivity with our hands. I can feel through many levels of tissue, and I get a feeling of where is the tension in the muscle? Where are the taut and tender fibers? Where does there need to be more motion between the vertebra? And that's what our training is, to release that tension so that the energy, the innate healing power of the body can function better.
Do you use any advanced technology for locating subluxations?
I do. I have something called a subluxation station, which gives me information about the autonomic nervous system and the musculoskeletal system. I use that along with an adjusting instrument, if I don't use my hands, to balance out the body.
I was thinking for a future show we should demonstrate the subluxation station, how it works. Maybe we can get a willing body in the audience here to help out. In the meantime, it's been really a pleasure having you on the show, and I mean that in many ways, to have you here. You had to be my first guest, of course.
Thank you very much.
And so
it was a pleasure. I hope you enjoyed it
and I hope you have back for future shows. And why? Because we are keeping it real about your health. Have a nice evening. Okay. I'm Dr. Mark Walcott, and I'm keeping it real about your health.